vomiting management. So today I'll explain the mechanism of vomiting, the 6 pathways that triggers vomiting, the symptoms associated with each pathway, and the antiemetics used for the management, right? Although vomiting has many different causes, all pathways finally activate one common center in the medulla, which is called vomiting center, right? So first of all, let's discuss about vomiting center. So it is located in the medulla oblongata and acts as the control room for vomiting, right? And it receives signals from 6 different pathways and coordinate vomiting reflex, right? The important receptors present here are NK1, 5-HT3, D2 receptor, H1 receptor, and M1 receptor, right? Now let's discuss each pathway in detail. First of all, the first one, chemoreceptor trigger zone, right? So the CTZ is located in the area postrema outside the blood-brain barrier. It detects toxins, drugs, and chemical circulation in the blood, right? Its causes are chemotherapy, opioids, digoxin, alcohol, uremia, pregnancy hormones, right? So due to these causes, it usually occurs. Now let's discuss the management of this pathway. So we basically give metoclopramide, that is D2 blockers, prochlorperazine, that is D2 blockers. We can give ondansetron, that is 5-HT3 blockers. We can also give aprepitant, that is NK1 blocker, right? Now let's discuss the second pathway, that is gastrointestinal tract. So irritation of the stomach or intestine releases serotonin, which activates 5-HT3 receptors on the vagus nerve. So this pathway, vomiting occurs this way in this pathway, right? Some of the common causes are food poisoning, gastroenteritis, gastritis, radiation therapy, GIT infections, right? And so far the management is concerned, we basically give ondansetron, that is 5-HT3 blocker, right? Now the third one, that is vestibular system, the most common one, that is motion sickness, right? So in motion sickness, usually cause conflicting signals between eyes and inner ear, which stimulates the vestibular nuclei, right? Its causes are basically traveling, it is car travel, sea travel, air travel, vertigo, right? And for the management, we usually give promethazine, dimenhydrinate, basically comes under the name of gravinate, meclizine. You can also give hyoscine, it is scopolamine, right? Now the fourth one, higher brain centers. So it occurs when strong emotions or sensory stimuli activate the cerebral cortex and limbic system, right? Its causes are fear, anxiety, pain, smell, emotional stresses, right? And the management is such that by treating the underlying cause, it gets recovered by itself. Now the fifth one, pharynx. So by touching the posterior pharyngeal wall, which stimulates the glossopharyngeal nerve and produces the gag reflexes, right? We have experienced it in our daily life, like when we put our fingers in our mouth deeply, so we experience gag reflexes, right? Its causes are dental procedures, endoscopy, foreign body, and throat infections, right? Now, the management is such that we need to treat the underlying cause. Like we need to remove the cause and it will recover by itself. Now, the sixth one, other visceral organ. So, disease in abdomen or thoracic organs stimulates vagal and sympathetic nerves and thus activates the medulla, and we usually vomit then, right? Its causes are appendicitis, pancreatitis, renal colic, right? Peritonitis, myocardial infarction, gallbladder diseases, right? And its management is the same, that we need to treat the underlying cause, which can be anyone in these diseases, and it will recover.